Hello and welcome to another episode of Boom and Bust. I'm your host, Tony Clement. I am here at the News Forum where all voices matter. According to Second Street think tank, government data shows an alarming failure of the Canadian healthcare system to treat patients in a timely manner. Here to talk about this is Harrison Fleming. He's the Director of Policy and Legislative Affairs at Second Street. Welcome.
Thanks for having me on today.
So I guess the first question is just on that, before we get to the what and the why, maybe how did you do your analysis? And then we'll get to what it shows.
For sure. So, what's important to note is none of this data is actually proactively tracked by the government. And so, Second Street has to send out freedom of information requests to provincial governments, health authorities, and healthcare providers all across Canada, hoping for a response that they'll actually tell us something with the data that they do actually track. And we found out when we first did this in 2018 that no government tracks this data on purpose. And so the data that actually is responsive to us comes from existing technology that they use to, for example, book appointments. And so when an appointment is canceled, they'll go in and say, "Oh, a patient may have died," and that's how we get that information. But it's not a great landscape across Canada right now because Quebec, Newfoundland, and Labrador, most of Manitoba, and now this year Alberta didn't provide any data at all. So there are some holes in the data, but what we do have still tells a very troubling story.
Yeah, so that is alarming about the lack, about this big gap in government data, right?
Yeah, absolutely. And we hear this time and time again. Governments always commit themselves to transparency and they say, we want to get better and we need the facts to get better. And yet they don't tell us the truth about the healthcare system right now because we know just based on these reports that we've been doing for the last 5 years, frankly, this is a problem that isn't just happening in Canada. It's a problem
Right.
that's getting worse.
Let's get to some of the numbers so our audience knows exactly what you're talking about, Harrison.
Absolutely. So just last year alone, from the numbers that we got responding to us, there was 15,474 Canadians who lost their lives while waiting for healthcare. And that's either a diagnostic exam or surgery. Now, because of those gaps that I mentioned, we've actually done the math and extrapolated that number across the country.
Mhm.
And if we include those jurisdictions that didn't respond to us at all, we have a number close to 28,000 Canadians dying waiting for healthcare just last year alone. Looking back to 2018, 2019, when we first started tracking this data, it's more than 75,000 Canadians who've lost their lives. And it wouldn't be impossible to suggest that number is nearly double, again, based on the fact that that number isn't from all the provinces.
So that number seems very high to me. It sounds outrageously high. Am I on track here to what you're thinking on this as well?
Absolutely, Tony. This is a huge problem, and we're seeing it get worse. Um, so the trend over the past couple of years doesn't look great. It's a problem that's been getting worse. Last year, we did have a slightly larger number than we had this year. It was about 17,000 people passing away while waiting for healthcare. But still, we're talking about tens of thousands of Canadians every year who aren't even getting care and then dying waiting for it. It's something that's shocking to think about in this country. We pride ourselves on having this incredible healthcare system. Many people say, "Oh, Canada is the best healthcare system in the world." Unfortunately, the numbers are telling us that's just not true.
Yeah, I mean, and I'm not sure there's a lot of people actually saying that nowadays. I agree with you. 15, 20 years ago, you'd hear that being said, but I think people intuitively know, and they probably know as a result of their life experience with a loved one or whomever, that we're not getting timely care. Are you getting that feeling as well?
Yeah, Second Street actually did some polling just last fall where we found about half of Canadians are avoiding the healthcare system altogether because they're simply too concerned about the amount of wait times that they're going to face. And that checks out because the Fraser Institute just released a report showing healthcare wait times are the highest they've been in 30 years, at more than 30 weeks on average. That's more than half a year Canadians are waiting for basic healthcare services.
Wow, I think there's a lot to dig into here. We're going to take a brief break, Harrison. I appreciate you coming on the program with this data, which is all from public. sources. They are you can't debate it in that sense. It's not as if you pulled it out of the air. So this is very important discussion. We'll be back after these messages. Please stay with us.